Very good afternoon and warm welcome to you all to this webinar on Mental Health Day. Myself, Dr. Dept, on behalf of National Homeopathy Research Institute in Mental Health, I extend greetings and World Mental Health Day wishes to you all. As we all know, 10th October is observed as World Mental Health Day globally. World Federation for Mental Health has declared this year's theme as Make Mental Health and Well-Being for All a global priority. World Mental Health Day is observed annually to improve awareness and to avoid stigma about mental disorders and to promote positive mental health. So today we have two pertinent presentations on this World Mental Health Day. Before we begin our webinar, I request our officer in charge, Assistant Director, Dr. K.C. Muralidharan sir, to deliver introductory remarks. We are sorry to say that Dr. Subhas Kaushik, DG CCRH, could not attend this webinar because sir is busy with another important meeting. So now I request AD and officer in charge, NHRIMH Kottayam, Dr. K.C. Muralidharan sir, to deliver the introductory remarks. Over to you, sir.
சரி ஆமா உனக்கு வந்துருக்கு இது எப்படி மியூட் போடுறது
I request Dr. K.C. Muralidharan sir, Assistant Director and Officer in Charge, NHRIMH Kottayam, to address the gathering on this webinar.
Hello. Is it audible?
Yes, sir. Yes, sir. You're audible. Please go ahead, sir.
Okay.
Yes,
Okay. So welcome back to our one of the webinar which we are conducting on the Mental Health Day, and that is very important. Actually, the two topics which we are covering: the responsibilities and mental health issues of the practitioners, and mental health issues related to the patients, also their responsibilities. This is based on the what we have observed and mental health regulations prevailed in the country. So I would like to thank both of the speakers, Dr. Gnnanaprakasham, Associate Professor, Department of Psychiatry, and Dr. Shanu Dhasan is our clinical psychologist in our institute. So thank you so much for accepting our invitation and coming for this wonderful day of mental health day, which we are going to actually make an awareness of this on this program. So due to some other preoccupations, I could not join completely in this program. So thank you one and all, and especially Dr. Dept and who will be conducting this program, and our Director General, Dr. Subhas Kaushik sir, is given us permission for conducting such a good webinar. So thank you all for your valuable time and this program because these are the two important topics which we are discussing today. So thank you one and all. Dr. Dept, please.
Thank you so much. Yes, sir. Thank you so much, sir. Although you are busy with another important meeting, thank you for taking your valuable time to address the gathering on this World Mental Health Day, sir. And today we have two presentations which are really pertinent very important in regard to mental health. The first presentation would be by Dr. M. Gnnanaprakasham on rights of persons with mental illness and responsibilities of mental health professionals. And it would be followed by another presentation, which is really useful for all the mental health professionals, stress management for mental health professionals. So kindly tune in, don't be distracted, be with us till the end of the session. And the end of true learning is change. And we hope these presentations will definitely bring a change in your thinking, in your practice, in all areas of your life. So now I want to introduce our first speaker, Dr. M. Gnnanaprakasham. Dr. M. Gnnanaprakasham has completed his undergraduation from Father Muller's Homeo Medical College, Bangalore, and he did his PG in MD Psychiatry from Vinayak Mission University, Salem. And currently, he's pursuing PhD in Child Psychiatry from Vinayak Mission University. He's a PG guide and also examiner under Kerala University of Health Sciences, Thrissur. And he has a rich experience working as assistant professor in Department of Hormone in VMHMC Salem. And also he worked as senior research fellow and research associate at NHRIMH Kottayam. From January 2010, has been working as assistant professor in Department of Psychiatry and in NHRIMH Kottayam. And currently he's working as associate professor, Department of Psychiatry, National Homeopathy Research Institute in Mental Health. He has more than 8 peer-reviewed international publications. Is currently a member of Indian Psychiatric Society since 2011, and he's a nominated member for Goa State Mental Health Authority by Government of India from May 2022. So we are privileged to have Dr. Gnnanaprakasham as a speaker today. I now invite Dr. Gnnanaprakasham to deliver his presentation on rights of persons with mental illness and responsibilities of mental health professionals. Over to you, Doctor. Dr. Gnnanaprakasham, you can unmute and start your video as well, yes, and share your PPT. Yeah, please go ahead, sir.
Thank you. Thank you, Dr. Dept, ma'am. I hope I am audible.
Yes, Doctor. Yes, sir. Please go ahead.
Yeah. So, Doctor, thank you for Dr. Dept for your kind words, and a very good afternoon to all. So, before going to my webinar presentation, I'd like to thank Director General Dr. Subhas Kaushik sir and our officer in charge and assistant director Murugan sir for this. Be highlighted for the next 30 to 40 minutes. So before going into the webinar, I would like to say a few words regarding this World Mental Health Day and about the theme of today's World Mental Health Day, that is making mental health and well-being for all a global priority. And this theme is brought up with the objectives to raise the awareness and to mobilize support on mental issues. The other objective of this theme comes from to make awareness about the stigma and discrimination associated with this mental illness. So when you see the theme of this mental health day, there are 3 main contents has been emphasized here. One thing is regarding the mental health, and the second one is regarding the well-being, and the third is a global priority. So what is mental health? So by WHO definition, the mental health is a state of well-being. Again, this well-being is coming into the part of the mental health definition. So it is a state of well-being that enables people to cope with the stresses of life events and to realize their own capabilities or abilities and to learn well, to study more, to learn, acquire knowledge more, and to capacity to work productively and effectively and to contribute to the community or contribute to the society. So this is the definition given by WHO regarding mental health. The second concept is regarding the well-being. So by the philosophical ground, this well-being emphasizes two main parts, that is the optimal functioning and the own or self-experience. And this optimal functioning and experience is characterized by two main things what we usually experience. That is, one is hedonism and the second one is eudaimonism. These two concepts on the philosophical background. So what is this hedonism? It is a part of subjective feeling. The subjective feeling of experience of pleasure, experience the pleasure and avoid the pain. The second concept is that eudaimonism, which is an objective part of this well-being. So which says the realization of one's true potential of purpose of meaning life. The realization of one's true potential and the experience of purpose of meaningful life. That is the second part of this well-being. And the third part, what this team says, a global superiority. Why it's come to in this global superiority? So when you talk about this global superiority, there are certain statistical report which makes to include this term to consider this mental health as a global superiority. So based upon those, the main study which has been conducted in 2015 by Ministry of Health and Family Welfare, it says around our Indian population there are 140 crore populations. The psychiatric comorbidity comes nearly 10%. It means that there 14 crore people are suffering with this psychiatric comorbidity, and the severe mental disorders, the statistical report says in India that is 0.8%. That is nearly 80 lakhs to 1 crore population is suffering with this psychiatric comorbidity. So all these issues we have to compare in the three levels. That is how this happened before the COVID time and during the COVID time and after now the current COVID. So this
excuse me, Dr. Gnnanaprakasham. Excuse me, sir. May I request all the participants to kindly unmute your microphones, please? I repeat, all the participants are requested to kindly unmute your microphones. Please keep your microphones under mute so that others will not be disturbed. Kindly comply. Yes, sir. Please go ahead. Please share your. Yeah, please share your PPT as well.
This is just a very short introduction, so I have the PPTs for this team. So next for the proper presentation, I will be sharing the slides. So I hope my audio is clear, and I also request all the participants to mute your mic. And any doubts, please put it in the chat box, and it will be addressed soon. Okay. So the third concept is the global superiority. What I was discussing regarding the statistical report previous the COVID time and also during the COVID, what it happens and the current scenario and after the COVID. So when you see the psychiatric morbidity, there are nearly 14 crores people are having psychiatric comorbidity and 1 crore of people having a severe mental illness from the survey done by Ministry of Health and Family Welfare. So when you consider this concept, when we divide this population into 4 or 5 categories from the baseline, so the basic group of peoples lie in the baseline or the group of peoples who are having this well-being concept. So well-being means the person knows their capability, the person realize their difficulties, they're able to cope up with their struggles and work hard to practice yoga, meditation, and they are capable by themselves to maintain their mental health and to survive in a well-being mode. So the second, above this well-being group, we have the second group of people who is little bit worried. So little bit distracted from their mental health due to the stressors in their life, due to this COVID pandemic, due to any catastrophic events, due to any sudden accident, sudden loss. So this group of peoples is about the well-being group. That is second group is worried type of peoples where the self-regulation and certain kind of support is more needed for such groups. Above this, there is a third group where it is classified as a high-risk group. High risk is psychiatric conditions where there is a strong family history of psychiatric conditions and also there is a relevant history of chromosomal and other psychiatric disorders. Above this, there is a certain small group, that is the fourth group, that is the person having chronic mental disorders who is already diagnosed and they are continuing or having irregular medication with their psychiatric condition. That group of peoples are considered or clubbed into chronic mental disease group peoples. And more than the supreme, the top in the pyramid, that is the top in the classification, that is people with severe mental diseases like schizophrenia, BPD, and other personality disorders. And these people definitely need a hospitalized treatment. So from the ground to the top, the 5 categories, that is from the well-being group to the severe mental disorder group, we need different types of approaches. We need different types of management, professionally, hospitalized, just a counseling and guidance, and just a moral support, or the person who can self-regulate among themselves. So keep it in mind, this mental health has to be taken into the global priority. The other survey, that is, I need to talk about the survey findings of National Survey Extent and Substance Use in India and by Ministry of Social Justice and Empowerment says currently there are 2.9 crore people are addicted to alcohol. It is not use of alcohol or having the habit of using alcohol. 2.9 crore people are addicted to alcohol in 2019 survey. And also the other substances, the survey says there are 25 lakh people addicted to cannabis and also 28 lakh people are addicted to opioids and 18 lakh people are addicted to amphetamine and 10 lakhs people for cocaine and 12 lakhs for hallucinogen. And finally, there is a very important thing that 7 lakh children are addicted to inhalants. So keep it in mind that the mental health is deteriorating due to a lot of crises happened between this past 2 years and before areas also. This global priority has to be addressed well and make mental health awareness all over the world and to make the services to reach all group of peoples in the to stress more, that is suicide in India. In 2019, by the report given by National Crime Branch Bureau says there are 1,39,123 suicide reported and in an average it is 381 completed suicide per day. And attempted suicide is just into 20. So out of 20 attempted suicide, 1 suicide will be successful suicide. This statistics is before 2019. And all this statistical report has been increased to 25% after this COVID in the current scenario, what WHO defines and what WHO says. And suicide attempt, it is increased by 10%. And in the report of disability in daily living years, depression stands the second, the topmost 10 illness given by WHO, and the anxiety disorder stands the 6th illness given by the WHO and Central Disease Information. So keeping all this in mind, this mental health awareness is taken into a global priority, and these 2 terms, that is a mental health and also well-being, has to be addressed, has to be practiced and provided service to all the people with mental health problems. So this is a short theme behind explanation of the theme behind this Mental Health Awareness Day. So now we will go to the webinar presentation. So I would like to express my thanks again to my officer in charge and Director General to providing this opportunity. So today I am going to talk about the rights of persons with mental illness and the responsibilities of mental health professionals. So I can share my screen. Whether my screen is visible, ma'am?
No, sir, it's not yet visible.
One second, one second.
Now I have stopped sharing this thing. Yeah, please go ahead.
Yeah, now is it visible, ma'am?
Yes, yes, sir, it's visible. Please go ahead.
Yeah, thank you, thank you. So for next 20-30 minutes, I am going to address or going to explain there are a few rights of mental illness and responsibility, persons with mental illness, and also the few responsibilities of mental health professional. So before going to the presentation, there are a few areas we are going to learn today through this objectives. That is, we are going to know about a short introduction of Mental Health Care Act 2017 and the preamble of the Act, the core meaning of the Act, and the definition of mental illness as per Mental Health Care Act, and the chapters included under this Mental Health Care Act, and the right of person with mental illness, which we are going to discuss in elaborate only this chapter, that is the 5th chapter of this Mental Health Care Act 2017. And the next part, mental health professionals, who are called mental health professionals, and responsibilities of mental health professionals. And this responsibility of mental health professionals has been highlighted in a very short way, where there is no specific guidelines and directives given in Mental Health Care Act 2017. So coming to the basic introduction, how this Mental Health Care Act has a start from. So this had at the origin from the United Nations Convention of Rights of Persons with Disability, which has been conducted on 13th December 2006. And on the convention, the ratification of United Nations Convention of Rights of Persons with Disabilities was happened in October 2007. And India is one of the signatory from 1st October 2007. So they try to harmonize the existing law with the convention, and they found the Mental Health Act 1987 does not adequately protect the rights of persons with mental illness either, nor promote their access to mental health care. So they try to fulfill this public statute to and that is regarding Indian Lunacy Act on 1912, so which emphasize more on custodial care of person with mental illness. So this act is more emphasized related to the custodial care of person with mental illness. And the next Mental Health Act 1987, which emphasize more on the treatment of person with mental illness. How to treat the person with mental illness has been more emphasized in Mental Health Act in 1987. And the last recent one, that is Mental Health Care Act 2017, emphasized more how to protect the human rights during the treatment of persons with mental illness. So the Mental Act has been converted into Mental Health Care Act 2017, and it emphasized more to protect the human rights during the treatment of person with mental illness. So these three main acts has played a major role in the progress or to maintain or to safeguard the rights of persons with mental illness. So on the preamble, which says the core meaning of the total act says that it is an act to provide for mental health care and services for person with mental illness, and it protect and fulfill the rights of person with mental illness during the delivery of mental health care and services and for the matters connected therewith and incidental therapy. So this act provide the mental health care and services for persons with mental illness to protect, to promote and fulfill the rights of the person with the mental illness. So this forms basic preamble of this overall Mental Health Care Act 2017. So definition of mental illness as per Mental Health Care Act, I am explaining a few important terms which has been repeatedly used in this Mental Health Care Act. So only 2-3 slides I will be highlighting those important terminologies or terms used in this Mental Health Care Act. So definition says the mental illness is the disorder of mood, thought, perception, orientation and memory, and which causes a significant distress to a person, and which must produce a significant distress to a person or impairs a person's behavior, judgment and ability to recognize the reality, that impairs the person's ability to meet the demands of daily life. And definitely it should have an impact of a person's ability to meet the demands of daily life. And it includes the conditions associated with abuse of alcohol and drugs, and it does not include the mental retardation, which is called as intellectual disability. So this is the mental illness definition given by Mental Health Care Act 2017. And it includes the chapters. I'm just giving the heading of all the chapters and respective clauses. And it includes nearly 16 chapters and 126 clauses. And I'm just giving the name of the chapter and only the chapter 5, that is rights of the person with mental illness, I'll go in detail. So chapter 1 is the preliminary and with the clauses 1 and 2. And chapter 2 is a mental illness and capacity to make mental health care and treatment decisions. That includes clause 3 and 4. And chapter 3 is advanced directive. And I will explain you what is advanced directive. That is includes between 5 to 13 clause. And the fourth one is nominated representative, which includes from the clause 14 to 17. And chapter 5 is the right of person with mental illness, clause 18 to 28, which we are going to discuss today. And the next chapter 6 includes the duties of appropriate government with the clause 29 to 32. And chapter 7 includes the Central Mental Health Authority, which includes from the clause 33 to 44. And chapter 8, the State Mental Health Authority with the clause 45 to 56. And chapter 9 includes the finance, accounts and audit related to the mental health services. And it includes clause 57 to 64. And chapter 10, it includes the mental health establishment, that is mental health hospitals, that is clause 65 to 72. And chapter 12, that is mental health review boards, that is clause from 73 to 84. And again, chapter 12, the procedure for admission, treatment and discharge of any mentally ill person in a mental health establishment. That includes the clause from 85 to 99. And chapter 13, it says the responsibilities of other agencies, the police personnel, the Department of Social Justice and other agencies which have a very close relation or reference to this mentally ill persons, which includes the clause from 100 to 105, and chapter 14, the restriction to discharge functions by the professions not covered by the professions, that is 106, and chapter 15, which includes offenses and penalties, that is includes in the clause 107 to 109, and chapter 16, other miscellaneous things related to the mentally ill persons, and few modifications and differences between Mental Health Act on 87 and 2017 has been assessed for in miscellaneous, and it clause related to 110 to 126. So next we'll see this term, one or two terms, that is what we use in, repeatedly in this act, that is mental health establishment. It is nothing but mental health hospitals. So according to this Mental Health Care Act, they have given the clear definition what mental health establishment means. It is any health establishment including Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy establishment by whatever name called, either wholly or partly meant for the care of persons with mental illness, established, owned or controlled or maintained by the appropriate government or local authority or any trust, which may be private or a public, corporation, cooperative society or organization, or any other entity or person where persons with mental illness are admitted and resided or kept in for care, treatment, convalescence and rehabilitation. So those home also called as mental health establishment. It also includes any general hospitals or general nursing home established and maintained by the appropriate government and local authority, trust, private or public, corporation, cooperative society, organization, admitting and treating the person with mental illness. So these are the three subcategories what Mental Health Care Act says related, they call it as mental health establishment. Next, what is this advanced directive? So this is the right of the person with mental illness to decide how he or she should or should not be cared and treated for his mental illness. And every person who is not a minor has a right to make an advance directive specifying any of the following, that is, the way of a person wishes to be cared for and treated for a mental illness. And the second option, that is way he wishes not to be cared for and treated for a mental illness. And the third one is the nominated representative. So next we'll see what is the nominated representative. So this is every person with mental illness has the right to appoint a nominated representative. The nomination shall be made in writing on a plain paper with the person's signature or thumb impression of persons referred to. And this nominated representative shall not be a minor, be competent to discharge the duties or perform the functions assigned to him under this act, and give his consent in writing to the mental health professionals. And in case there are no nominated representative was chosen, the following people will be chosen for the purpose of this act. That is, the individual appointed as a nominated representative in the advance directive, or any relative or any caregiver, a suitable person appointed as such by the consent board, that is state mental health board. If no such person is available, the board shall appoint the director, Department of Social Welfare, or his designed representative as the nominated representative of the person with mental illness. This happens in cases of destitutes and orphanage and the person who has been thrown out from the home with mental illness. So next we'll go to the subject content, that is right of persons with mental illness. There are 10 to 11 right of a person with mental illness to be addressed and to be respected while treating the person with mental illness. So first, there is a right to access mental health care, the right to community living, and right to protection from cruel, inhuman and degrading treatment, and the right to equality and non-discrimination, and the right to information, and the right to confidentiality and restriction on release of information in respect of mental illness, and right to access medical records, right to personal contacts and communications, and right to legal aid, and also right to make complaints about deficiency in provisions of services. So to the first right, that is access to the mental health care, there are few points stressed more how the person can access to the nearby mental health care establishment, and what are the benefits and what are the other things the government and geographically accessible without discrimination, gender, sex, sexual orientation, religion, disability, and service like the acute mental health care service such as outpatient and inpatient services, halfway homes or accommodations and supported accommodation, and services to support family of person with mental illness or home rehabilitation, community based, and also should be government. The approach shall create the health service and all programs. So government should clear insight that this mental services should not into a separate mental health establishment. So all public level health sectors from the general health service, this has to be integrated as a small OPD setup or one of the small center in any primary, secondary, tertiary health care in all. So the person with mental can easily access to any mental health services.
Meeting.
So just be participant to mic, please. The appropriate government provide services help the person with mental illness to live in the community and with their families, and it should appropriate government should take care. There should not be a long-term care at the mental health only at conditions. It should not be practice that the mental has been the mental health for a long time. You the take care of the person with mental illness. Avoid travel of child or old age persons with mental illness for their service, and it should ensure at least minimum mental health service available in each district. Not available at this level, that person with mental illness is entitled to access any other mental health service in the district, and the cost of at establishment be bought by the appropriate government. A few other appropriate government should ensure the available basic and MK services are. So sorry for the interruption. I think my voice is breaking due to the poor network brand. So I am muting my video. So I hope my audio is clear now. So we will continue with the access of the person with mental illness to mental health care. So the next point we are dealing with person with mental illness living in the below poverty line or who are destitute or homeless shall be entitled to the mental health service and treatment at free of any charge and at no financial cost charge at all mental establishments are funded by appropriate government. And the next, the mental health service shall be of equal quality to other general health services and no discrimination be made in the quality of services. The minimum quality standard of mental health services shall be made available as specified by regulations made by the state authority. And there will be a special drug list available free of cost to all persons with mental illness at the time at health establishment, at all times at health establishment. And they are also specified there must be essential drug list of each system under NHRIMH shall also be made available free of cost at any integrated health establishments dealing with Ayush managements. The last one, the budgetary provisions shall be practiced in mental health service in terms of its adequacy, priority to the service, and progression of such schemes or policies and equity among general conditions and mental health services. This is right under access to mental health care. And next we'll see the right to live in community living. That is the right of a person with mental illness to live in community, be a part of and not to be segregated from society. And not a person does have a family or is not accepted by his or is homeless due to absence of community-based facilities. So appropriate government should provide actions include legal aid for the abandoned person with mental illness, family home, and live in the appropriate government within a reasonable support to the establishment of the less restrictive community-based establishment, including halfway homes, group homes, and for persons who no longer require treatment in more restrictive mental health establishments, such as long-stay mental hospitals. The next, we move on to the third right, that is protection from cruel, inhuman, and degrading treatment, which is used in most of the mental health establishment when the patient is highly violent or when the patient is highly uncooperative and self-harm and harm to others. And this will be emphasized that person with mental illness shall have a right to live with dignity, and person with mental illness shall be protected from a cruel, inhuman, degrading treatment in any mental health establishment and shall have the following rights. There are many rights has been highlighted there. I am highlighting those rights which has stressed more. That is to live in safe and hygienic sanitary conditions, to have a facilities for leisure and religious practices, for privacy, for proper clothing, so as to protect such persons from exposure of human body to maintain his dignity, to not to be forced to undertake work in mental health establishment and to receive appropriate remuneration for work when undertaken. And a few other to be is to have adequate provision for living in the community, have wholesome personal in women personal hygiene be adequately addressed by providing access to not to subject to compulsory tonsering, that is shaving of head hair, and to wear if so wished, not to be forced to wear, and lastly, and to be protected from all forms of physical, emotional, and the next of equality, discrimination. There will be no discrimination on basis including gender, sex, sexual orientation, religion, culture, caste, social or political beliefs, class or disability. And the use of ambulance service and living condition in health establishments should be in the same manner, extent and quality as provided to the persons with physical illness. So there should not be any restrictions for provision of ambulance service and living conditions for mentally ill patients. It should be given equal opportunities as provided to the person with physical illness. And the medical insurance for treatment of mental illness shall be made available on same basis for the treatment of any physical illness. And provision for child under the age of 3 years of woman receiving care, treatment or rehabilitation at mental health establishment shall not be separated from her during her stay such an establishment. And it is accepted, that is, except in the case of and and can be separated maximum for 15 days. And this separation, if exceeds 30-day separation attested, it need to be get approved from the respective authority. And right to information for mental illness, it says the right to know information for which he has admitted, and if he is being admitted, all those information be open to the person with mental illness, and it has to be disseminated immediately on demand. Exceptions, I will explain you. Right to make an application to the concerned board, the admission, and the person with mental illness have the right to know the information regarding the treatment plans and probable side effects, and to receive the information in a language in which the person with mental illness can understand well. And the psychiatrists or mental health professionals treating the person with mental illness, and full information is provided promptly when the individual is in position to receive it, or immediately to the nominated representative on demand. And the right of confidentiality, the person with mental illness have the right to confidentiality in respect of his mental health care, treatment and physical health care, and all the health professionals practice, and we shall know the duty to call confidential as a few exceptions. The piece of information to the nominated representative to enable him to fulfill his duties, that is in the care of mentally ill person. And the release of information is to other mental health professionals, enable and to protect any other person from the only the information to protect against the harm identified and to prevent the threat to life. And there are certain exceptions that release of information upon an order given by the concerned board or central authority or High Court or Supreme Court, and in the interest of public safety and security. So next is a restriction of release of information. So at any mental health establishment, there is no photograph or any other information relating to the person with mental illness undergoing treatment at mental health establishment shall be released to the media without the consent of person with mental illness. And there is also right to confidentiality of person with mental illness stored in electronic or digital format, real or. So the next right is related to the access of medical records. The persons with mental illness, the person with mental illness have the right to access their own basic medical records. The mental health professionals may withhold specific information in the medical records if the disclosure would result in serious mental harm to the person with mental illness or likelihood of harm to other persons. In release of certain withheld informations, the mental health professional should inform the person with mental illness of his right to apply to the concerned board for an order to release such information. And the next one is the right to the personal contacts and communication. The person with mental illness have the right to refuse or receive visitors and make telephonic or mobile phone calls at reasonable times subject to the norms of such mental health establishment. And the right to send and receive mail through electronic mode, including the email. And the person with mental illness have the right to avoid and not to receive mail or email from any named person in the community by previous information to the medical officer or mental health professionals of the establishment. And there are few restrictions for certain peoples to have a contacts or communications, that is any judge or officer authorized by a competent court can make a personal contacts with the person with mental illness, and the members of the concerned board or central authority or the state authority can have a personal contact with the person with mental illness, or any member of the parliament or a member of state legislature and the nominated representative, the lawyer or legal representative of the person, and the medical practitioner in charge of the person's treatment, and any other person authorized by the appropriate government. So all those peoples have the right, have the access to the person with mental illness for the treatment and other mental health services provided to the person with mental illness. And the right to legal aid. And the right of a person with mental illness shall be entitled to receive free legal service to exercise any of his rights given under this act. And it shall be the duty of magistrate and police personnel and officers or person in charge of the custodial institution or medical officer or mental health professional in charge of the mental health establishment to inform the person with mental illness that he is entitled to free legal services under the Legal Service Authorities Act 1987. And the last one, that is right of complaints about the deficiencies practiced in mental health establishment. Any person with mental illness or his nominated representative shall have the right to complain regarding deficiencies in provision of care, the treatment, and the service available in the mental health establishment. It should be initially to the medical officer or mental health professional in charge of the establishment, and if not satisfied, can move to the concerned board. Still not satisfied, can move to the concerned state. And the provision for making complaint of above mentioned prejudice to the rights of the person to seek any judicial remedy for violation of the rights in mental health establishment or by any mental health professional. This act either law for the time being in force. That's all regarding the few important rights of person with mental illness as depicted in Mental Health Care Act 2017. Let's get to the very small part of the that is responsibility of mental health professionals, which has to be practiced very seriously. And there is no specific guidelines or specific directions has been emphasized in mental area in the mental health. It's just highlight of the responsibilities we have as a mental health professionals by practicing this mental health service. So first, we should know who have been called as who are called mental health professionals as per the Act. This first one, psychiatrist, psychiatrist by recognized by established under UGC grant of examination included in the first schedule Act 56. They constitute the Indian Medical Council Act and in relation to any medical to be a psychiatrist of this Act. Chapter 2, Section 2, 1 RI and next, that is a professional having a postgraduate degree in Ayurveda, that is in Manovigyan Manasroga, or a postgraduate degree in homeopathy in psychiatry, or a postgraduate degree in Unani in Molager, or a postgraduate degree in Siddha, it's in Syrup Martham. That is explained in chapter 2, section 2, 1R, third subclassification. And the last one, that is clinical psychologist, the mental health nurses and psychiatric social workers has been personals as called as mental health professionals. And the responsibility of mental health professionals know about the Mental Health Care Act 2017 and deliver the service in accordance with the Mental Health Care Act, to know in detail about the right of any person with mental illness, to know the procedure of admission, treatment and discharge of mentally ill persons as per Mental Health Care Act 2017 in any mental health establishment, to deliver ethical based mental health services at any point of time, to provide appropriate diagnosis, execute the safe with consent of person with mental illness or the nominated representative, to conduct mental health assessments in accordance with internationally accepted principles and the promotion of mental health and prevention of disorder and respect the rule of law. Few others has to keep it in mind, that is to understand the benefits of the public while executing the mental health services, to have time-to-time communication with the concerned board for providing and receiving any information, and to provide a standard care, quality, quantity in patients, guidance, and counseling. Certify persons with mental ill on demand for legal and financial under government schemes or policies. And lastly, to interact with the community, NGOs, and appropriate bodies in prevention of mental illness and promotion of mental health programs, and involving the community-based mental health service to address the need of all the persons having or enjoying this mental health, and to remove the stigma and to non-discriminate the person with mental illness for the community. So that from my side regarding the response of the person with mental illness for today's presentation. So thanks for your kind listening and to my webinar, and thank you all. And any doubts, queries, please put it to the chat box. So I will address to your doubts. Thank you, Nanda.
Thank you, Dr. Gnnanaprakasham M, for an enlightening and elaborate presentation on rights of persons with mental illness and the responsibilities of mental health professionals. It was a really wonderful session, sir. Now I request our next speaker to present his. Before moving to the next presentation, I would request the participants, if you have any queries, you are free to unmute your mic and you can pose your question to the presenter, or you can drop it in the chat box. Right now, if anyone want to ask the presenter, Dr. M. Gnnanaprakasham, sir, any questions, you are free to ask now.
I like to ask one question.
Yes, sir.
Earlier, in charge of CRI, earlier CRIH Kottayam, whether at the present that your institutes having all this mental act according to the 2017 are there or not? Because for the common interest, the public interest, I am asking, not asking.
Good afternoon to you, sir. I am to answer to you since sir has been in charge of this institute back. I was in. So, I would like to say we have started slowly the progress of our mental health establishment with the official rights are getting practice in the all our staff criteria, other points given to the Mental Health Care Act will be slowly implemented since active around 6 months. So there are we are in the slow process of attending all those procedures as explained in mental health care.
Thank you.
Thank you, sir. Thank you, sir. Thank you, sir.
Thank you.
I like to tell one more thing. I like to ask, be very careful because it is mental hospital. So that the act must be implemented as early as possible. Otherwise, there are. Okay, thank you.
Thank you.
Thank you, sir. Yeah. If anybody else has any queries, you are now free to unmute your mic and you can ask the presenter. Dr. Gnnanaprakasham is ready to answer your queries. The request all the participants kindly unmute your microphone unless you are talking. I request all the participants to kindly mute your microphone unless you have something to talk. If you have any query, you can just unmute and ask the presenter your question. So if there are no more questions, we are moving ahead. Next, we have an interesting presentation on Stress Management for Mental Health Professionals by Dr. Shanu, MD. So in the post-COVID times, it is really important for the mental health professionals as well as all the doctors and other health professionals to take care of themselves, their mental health, to manage the ongoing stress. So I once again request all the participants, please mute your microphone. Kindly, sir. Dr. Dastagiri, Dr. Mariamma, John G. Yeah, anybody else? You're not listening to the request, you to kindly mute your microphone. Sivakumar, Mr. Tulsi Nathan, Dr. Rajpal, please kindly mute your microphone, sir. Kindly cooperate. Next, we have our presentation on stress management for mental health professionals by Dr. Shanu, Mary Dhasan. Dr. Shanu has completed his MSc in clinical psychology from KU College, Ghana, and MPhil in clinical psychology from JSS Medical College, Mysore. He has a rich experience working as chief clinical psychologist for Manashrita Center for Counseling and Psychotherapy and consultant clinical psychologist for Prakti Child Developmental Center, consultant psychologist for content strategist for Mitsu Log Limited, and he has published peer-reviewed articles in Archives of Mental Health Journal. He is currently working as clinical psychologist at National Homeopathy Research Institute in Mental Health. I request Dr. Shanu Meridasan to present his lecture on stress management for mental health professionals. Over to you, sir.
Thank you, ma'am, for that introduction. I hope I'm audible.
Yes, sir. Yes, you're audible. Please go ahead.
I'm sharing my right now. I hope my screen is visible now.
Yes, sir. It's visible. Please go ahead.
Okay. First of all, I'd like to forward my gratitude to the senior members and officials of NHRIMH and the consultants for organizing this particular webinar and providing me the opportunity to speak about stress management for healthcare professionals, specifically mental health care professionals. So, as Dr. Dept said, my name is Shanu MD. I'm a clinical psychologist, and today I would like to talk about some specific strategies, some practical strategies for the listeners and of the practicing members about evidence-based real life and in your daily practice. So just for the sake of completion, I know everyone sitting here must know what stress is, but for the sake of I'll go over what so stress is a demand made on the adaptive capacities of the body. So demand that occurs on one's body, both and psychologically, and the response that you make is the stress response. So how the stress influences your pathology or your mental health is based on a couple of factors. The first one being your personal
Please
view.
little more loud, please.
Am I audible now?
Audible, but the sound is comparatively less.
Yes, the bandwidth is it's not working quite well. I apologize for that. I'll speak as loud as possible. So the way the stress influences our mental health and how it influences or causes psychopathology is based on a couple of factors. And the three major factors are the personal view of stressor. So how we see the stress as positive or negative, depending on that, our stress response becomes positive or negative. Our reaction, so basically how we behave to the stress response as part also is heavily contributing to the causation of mental health effects. So what we need to understand that is the actual event or the cause of this hurting, it is the event that might lead to certain mental health issues. And And finally, we have the body's capacity. Now, regardless of how we view this and how we react, sometimes the body is physically or mentally available, doesn't have the resources to cope with the stress. So based on the interaction of these primary three features, our stress responses are modulated, and as a consequence, they have an impact on our immunology, and then finally our psychoneurology. So basically, is stress good or bad? This is a thing, and it can be helpful. The issue is managing the stress muscles, the mental muscles that are useful for managing stress effectively. So then muscle over time grows in response. So avoidance to stress is not the answer. The key, in fact, finding the balance. Can I confirm from people? Are the slides moving?
Not moving.
It is moving from my side. Just kindly excuse me for a few moments. We seem to have technical troubles. Are the slides moving right now?
No,
No.
sir, not it. It's not opening. I think I'll share the screen itself. Can you please, could anyone please
No, it
confirm the
can
slides?
be seen. Okay, all right.
Okay. Thank you so much for that. Thank you for waiting. All right. So as I was saying, the key is always to find the balance of how much stress you're experiencing as opposed to how much stress you can respond to, or building your muscle to respond to the stress. Now, this principle can be clearly displayed by a principle known as a Yerkes-Dodson principle. So there is an optimal amount of stress that a person can experience that allows them to function effectively. And this is known as eustress. So in this state, a person experiences a gentle flow of right amount of challenge with right amount of stress. The person feels in control. There's a sense of acceleration, the sense of confidence, peaceful, and contentment as a result of dealing with the stress. On the other hand, when the stress becomes too much, when the feelings associated with the stress are causing distress, then the person moves on to anxiety, worry, rumination, overwhelmed, resistant, and so on. On the other hand, the exact opposite can also cause distress. When the feelings associated produce too little stress, that is also distress. And people in this state usually experience boredom, apathy, and unconcerned lack of interest, which can also contribute to certain kinds of disorders. Okay, sorry for the interruption again. So it is always about awareness. When you're trying to manage your stress, you need to understand where your stresses are coming from. So here is a small checklist for all the PGs and all the working professionals here to understand what is the primary source of your stress. It could be your time management. It could be your personal relationships showing their effects in your work life. It could be your personal expectations in your work setting. It could be actual biological, physical health issues that might be interfering with your life. It could be family expectations, environmental stresses, the choices that you have to make in life, living arrangements, for example, especially true for PGs who are studying in different places. So a lot of these external stresses and factors need to be made aware to an individual, because if you're not aware of what the problems are, then it is very difficult to solve your source of stress. The next level is to assess the stress. One, understand where your stress is coming from, what is the source of your stress. You need to understand how much it is impacting in your life. So are you aware whether your heart rate is increasing? Is it higher than usual when you're standing in a line? Anxiety to see patients who are coughing? You breathing from your chest? Or are you breathing from your abdomen? Is your rate of respiration elevated? And effects of your stress on a scale from 1 to 10. And understand that more than a 5 is worth noting for. Here is just symptoms for stress form that the PGs as well as working professionals can use, as well as hand out patients to understand the frequency of the symptoms, some of the very common autonomic symptoms that they feel when they're experiencing stress. If you need a more detailed assessment of there is a perceived scale, which is more clinical in nature. Once you understand the nature of the stress and the how much the stress impacting your life, both physiologically, autonomically, as well as in terms of performance and output, then what you need to do is create an account of the stress, which can be done using something known as a daily stress diary. So here, what you do is throughout the day, you write down the source of stress, the time and place associated with the stress, which place, which room, which time do I feel the most amount of stress, the subjectively perceived level of stress, and more importantly, the thought and feelings associated with your stress. What do you think about the stress? What do you think about your own behavior in reaction to the stress? And how do you feel about these things? And also, it is important and vital to understand what coping strategies are you used to dealing with the stress. Is it an adaptive strategy, or is it something of avoidant in nature, or blaming it on others? So you need to understand how you're reacting to the situation as such. So at the end of the day, you will gain an understanding into what are your major sources for the stress, and also a personal assessment of how well you have managed your stress today. These are about understanding and becoming aware about stress. But what do you do to prevent and manage your stress? So here comes the power of perception. So why do people react to situations differently? A same person in one situation reacts in a completely different way from another person in the same situation. So it's all about the perception. Your experience of stress depends on your strategies for coping with stress, which relies on previous experiences, memories, childhood learnings, and finally, it genetics and current social support. So here is a quick technique that anyone can apply in their lives to deal with the stress of life. It is known as cognitive restructuring. And to understand how to do cognitive restructuring in your life, just keep the POP formula inside your mind. The POP stands for of positive perception. This is a point in time when your thoughts initiate a stress response. So in the cognitive model of all stress, thought is the unilateral point of origin of stress, rumination, negative emotion, and negative somatic symptoms and behavior. So at this understanding where you initiate your stress, you can make a conscious decision to choose positive thoughts to reduce stressful levels. Perception will stop the stress and prevent healthy and unproductive reaction. Process known as naming. Now, here's a tool that you need to do cognitive restructuring in your daily life. It's known as a thought record or a thought diary. It's very similar to a diary keeping process, but it's have a column for a date and time when issues have started. Then there is a situation, a specific event, a stream of thought or events that started at a particular point. You're going to write that situation, perhaps dealing with a patient, a difficult patient, perhaps dealing with your children. In the situation, what automatic thought did you encounter inside your mind? So write those thoughts down. What thoughts or images or what memories to your mind? And as a consequence of these thoughts, images, and memories, what emotions do you experience? Simply, quite simply, single word like sad, anxious, and so on. Understand the situation is related to the automatic thoughts you are generating and how these thoughts affect because of the emotions. Then you're left with a choice to have an alternative thought. Instead of the automatic thought, what other alternative thought can I have? So first, identify cognitive distortion that you're making. So maybe my thought is not real. It is perhaps an exaggeration, perhaps there is a of paranoia. You understand kinds of cognitive distortions, which are like all or none principle. There is magnification, discounting the positives. There are many kinds of cognitive distortions, the biases basically that we have towards us and to the world. Do I have these biases? You start beginning to question thought. Just because you had a thought doesn't mean that it's true or real. Question your thought in that the thoughts don't matter. And once you realize that the thoughts are not exactly true, you can look for an alternating thought, something that is more positive. And as a consequence, because of this new thought, notice how much less do you believe your previous automatic thoughts, how much better you are feeling emotionally now because of the new positive thought. So this is a very powerful form of changing the way you're thinking. And even over time, it enhances the utility of neuroplasticity to change the wiring of your brain to change the way you're thinking. Some cognitive strategies are that are taken in dialectical behavioral therapy is accept it's a gray. Some people just can't accept the world as a mixture of black and white. It has to be either black or white, either yes or no, either right or wrong. That is not an accurate reflection of the world. Sometimes the world is gray. Just because something is not perfect doesn't mean that it's terrible. Most important, don't think personally. Say wrong, and that is fine. Accentuate the positive, which is quite opposite discounting the positive. People tend to discount the positives in their life, which is a distortion. And instead of recognize you're doing and then moving on to accentuating, focusing on positive aspects, your achievements, and downplay the negative aspects of your mistakes. Learn to compliments, don't deny. Take that thank you, take that well done heartedly. The best in any situation instead of magnification, catastrophe. Tune the best what situation has to offer and try to see the best in people. And believe in your ability to control your emotions so that you do well, choose how to the stresses. Here is a good example. Like if you think that positive restructuring or reframing is a simple technique. Here is an image that illustrates how powerful this technique. Bronze medalist at right hand is quite happy to be in the medal gold medal is quite but you can clearly see the silver medal, not realizing that it's all because of that you say to yourself. On the silver medalist is probably I have got the gold medal if I tried well. Things that and but how's that's a choice you have to make. Moving on, moving from cognitive restructuring to the power of mindfulness. Mindfulness is an ancient practice that we have started in India and currently taken to the scientific study and implementation in therapy by Western scientists. Now, mindfulness is all about being present in the moment. So it is an understanding of what reality is versus unreality, because reality occurs in the present moment. Anything that has gone past or anything that has yet to happen as instead of concerning yourself yet to happen reality, mindfulness enhances your attention to focus on the present, the here and now. It's all about thinking like a child into moment without judgment, without your audience. Not to talk about mindfulness, I will quickly go take the people attending through a small mindful space exercise. So those who can attend and practice this with me now, we're going to take 3 minutes, and those who can't, completely fine. 3 will be taking. Just follow my hands and listen to and try to experience that you're trying. All those do this on your relax, find a comfortable sit and in a comfortable position. And I want you to close your eyes and take a deep breath in. And as you take a deep breath in, I want you to notice the sensations in your nose. Perhaps a cold rush of wind in your nose. Pay attention to that physical sensation. And then let your breath out. Once again, taking a deep breath in and noticing the physical sensations in your nose. Just paying attention, no thoughts. Holding the breath for 2 and slowly letting it all out. Now, I want you to do this for the next seconds as comfortably and quickly in your pace. And I'll be quiet for 10 seconds and then we'll continue. Okay, so I hope at least the participants were able to do this exercise and others time to mindfulness breathing space. A lot of neuropsychology going in this breathing exercise. The whole point of this breathing exercise is to stop the rumination that is associated with is a certain group of your parts of your brain, including the medial prefrontal cortex, posterior cingulate cortex, and the angular gyrus. It is for ruminative thought or thought chaining, which is usually negative in nature or with a negative valence associated with it. So the idea of doing mindfulness breathing space is to reduce the activity of DMN, the default mode network, and activate something known as the dorsal attentional process or the dorsal attentional network, which is a competing network to this default network. Instead of thought chaining and thought rumination, you're allowing your body and mind to settle down physically and your mind to stop the thought chain, which allows you to stop thinking negatively and perhaps even start a new thought chain that is more positive in nature. So I hope that will help a couple of people. Apart from sitting at one place and doing your mindfulness exercise, mindfulness can be applied to your daily life as well. So I want you to notice like how mindful and how patient you are with yourself, how judgmental and ability to remain calm in certain situations. So when you're waiting in an express line in a grocery store or in a queue somewhere to buy a ticket, how patient are you? How How do you react when you are hungry and seeing a patient? Perhaps? When your consultants give you extra work or assignments on a very, how do you react internally? What thoughts come to your mind? These aspects, these listed in to be judgmental. Not able to do so, then I highly suggest that you practice art and mindfulness. That I really love, we can all use stress and manage stress, and that is known as flow state. Flow state is a beautiful concept that was uh, researched well into by a psychologist known as Mihaly Csikszentmihalyi. And Mr. Mihaly, Dr. Mihaly describes or defines flow states as a sense of fluidity between your body and mind. The distinction between the body and mind when you're doing an activity changes. It is a state when a person is completely absorbed and deeply focused on the activity that they're doing, beyond the point of distraction. So when, for example, when people are doing sports, when doctors are performing surgery, when you are engaged in a highly creative art project, people tend to lose themselves in the project, and as a consequence, become one with their actions and experience a deeply focused state known as flow state. In this state, the people usually experience time dilation. The time seems to slow really down, and your senses are really high. In this state, you're one with the task at hand, just like an Olympic athlete. Thinking about the future, just responding to each moment as they can. Get into the flow state. This entering into flow state leads to a sense of ecstasy, a blissful, a sense of clarity. Usually the thought chaining and the ruminations I talked about when your default network is activated, they tend to fade away. Normal sensations of inhibition, hunger, fatigue melt away. They all fade away, and you're completely good and focused. Is a sequence of states. To anyone, whether you're engaged in a physical activity or creative pursuit, and more importantly, even every day-to-day task. You know exactly what you want to do from time to time, and you get immediate feedback when you are in your flow state. So the question now remains is how to enter into flow state. So usually flow states don't occur when you are in a very calm, relaxed state, but instead when you are relaxed at the same time, you're alert and you're challenged by your activity. So when there is sufficient amount of challenge, not too much, not too little, not too little to bore you, not too much to overwhelm you, but the right amount of challenge and absorption leads you to enter into flow state. And mindfulness training, especially non-distraction and the ability to continuously sustain your focus, enhance your ability to every activity. So mindfulness in every combined with the right amount of challenge enables anyone to engage in flow state. Basically, flow state is a very active, moving type of meditation. Apart from internal strategies and apart from cognitive strategies, we must also focus upon the external strategies to respond to stress. So stop big time and life management. Have schedule. Do you use apps and softwares to manage your schedules and time and tasks for that matter? If financial obligations are a big issue in life, how are you managing your money? Are you consulting someone? Do you use a book to manage the expenditure or incoming of money? How well are your social support and how well are your social relationships doing? Are you ignoring your social relationships? Healthy lifestyle. How well are you treating your mind and your body? Your sleep routine, your appetite, and so on. Finally, spirituality literature has found that spirituality helps a lot in maintaining a good stress management or prevention for individual. So next, once we are trying to prevent or being resilient to stress, but how do we reduce the stress once the stress? That is where relaxation training comes in. So the process of really moving the mind and the body from stress response to the relaxation response, that is the goal of exercise. So a relaxed start, a calm mental state, and a decreased physiological function, such as muscle tension, blood pressure, and heart rate. So relaxation watching a sunset can be a distraction for logic aspect, activating your parasympathetic nervous system. That's how to do exercise. So one of the primary ways of achieving deep relaxation is through a process known as deep breathing. And it is discounted and underestimated technique to understand the kind of breathing that under stress or under anxiety. I want you to notice abdominal breathing, which is deep breathing. Breathing. If it's a thoracic or a chest breathing, shallow breathing is a fight response. On the other hand, abdominal or diaphragm breathing involves inhalations that allow the diaphragm to contract and move down, drawing more air into the lungs. So do exercise. So to do the one this number sequence, being full of inhalation, seconds of and seconds of exhalation. In order to help yourself or through the deep breathing exercise, here is a picture where you can put one hand on your chest and another hand near your stomach or your gut. And when you do this exercise, I want you to notice when you take the 4-second inhalation in, notice if your stomach moves, whether the hand on the stomach moves more than the hand on the chest, which is indication of a deep diaphragmatic. On the other hand, it moves of a short thoracic breath, which means you're not doing it right. A deep breathing always involves a deep diaphragmatic breath. For some people, the 4-second inhalation is very difficult. And for that, I recommend them to start with a second exhalation. To max out is still lungs, there is still air in the lungs. So you would want the lungs to go out to counting 6. Once you reach 6, take a 4-second deep inhalation and then continue the sequence. The sequence is supposed to be done for 8 repetitions or until you notice your stress response, your autonomic responses slowly coming down. The next very common relaxation exercise done in a clinical setting is known as a PMR. The PMR stands for progressive muscle relaxation. So these are techniques designed to reduce muscle tension through focused. And this is achieved, or this achieves activation of the parasympathetic nervous system. This is done through alternatingly tensing and relaxing specific muscle groups. So here on the next page, you have an image over here that shows different muscle parts. The first part you can see, the hands, the fists are tightened really tight. It is held like that for 5 seconds. And now, seconds you alternate it with relaxation by opening up your arms and relaxing the muscles. And this relaxed state starts for 10 seconds, lasts for 10 seconds. Now this process for the hand itself, that specific muscle group is repeated for 3 times. And then you move on to other body parts. For example, your chest, your shoulder. Here you can see how the shoulders are stretched upwards. In the lower part of the picture, you can see how the legs are constricted or contracted in the first picture and then relaxed in the second picture. So 5 seconds of keeping your muscles tight, followed by 10 seconds of relaxing your body and repeating each muscle group 3 times. The bottom leftmost picture, the facial muscles are constricted tight for 5 seconds. And the adjacent image shows how it is kept relaxed for 10 seconds. Again, repeated 3 times. Every muscle group in your is targeted like deep extend of relaxation. Applied response to stress or anxiety can be done as a response. The next and one of my favorite strategies for reduction of existing stress is known as guided visual imaging, in the form of cognitive relaxation. So here you are to use your imagination. So the people who are finding it difficult to use their imagination can stick with PMR, but then the people who love to imagine things or can form vivid imagery inside their mind, they can use guided imagery. So here, hypnosis is a state of attentive, focused concentration with suspension of peripheral awareness. So it is characterized by extreme suggestibility, relaxation, and heightened imagination. So just a heads up, like when we talk about hypnosis here, we're not talking about the classic Freudian psychodynamic unconscious, subconscious hypnosis. It's all about paying attention, ability to modulate your attention to derive a specific guided imagery. So to give you a quick example, anyone who is willing to imagine, I want you to imagine a nice yellow lemon, a piece of lemon. And you're taking a really sharp knife and cutting the lemon into half. And you have the smell of the lemon going out from the lemon. And you take the piece of lemon gently to the tip of your tongue and gently squeezing the sour lemon juice on the tip of your tongue and allowing that to spread through your tongue, feeling utter sourness. Now, this description for the people who are imaginative enough, they might have noticed that their mouth started salivating. And this exactly is the part of visual imagery that we're trying to utilize, because the power of suggestibility over a physiological response has been proved in multiple researches. So the efficacy has been showed to improve performance skills, where you're trying to be a performance artist, an Olympic athlete, improvements in confidence and positive thinking. Again, hypnosis or guided imagery, just like mindfulness, stops or reduces the activity of the default mode attentional network and activates the dorsal attentional network. It enhances problem solving. A lot of scientists utilize these methods to enhance their problem solving. Performance review. This is a beautiful application of guided imagery. People imagine performing a very complicated task and they review the mistakes inside their mind. Well, when they actually do, the chances of performing a mistake drastically reduce. And finally, to control the physiological arousal and anxiety that they feel in their work environment, in their personal lives, and so on. So again, I would like to quickly take you through a small guided imagery exercise lasting just a couple of seconds. So anyone who is able to and willing to kindly listen to my voice and follow my suggestions. Sit back, relax, in a comfortable position to relax your body. I want you to close your eyes and take a deep breath in and out. And notice how you breathe naturally in and naturally out through your nose. And if you're able to do this, I want to imagine that you are by a lake on a warm, sunny day. It is a large, clear, very blue lake. The sun is shining warmly on the lake, reflecting the sunshine. And you can imagine that you are a small stone flake, a piece of stone near the lake. And imagine being tossed into the lake, out into the middle of the lake, skimming onto the cool, clear, blue waters of the lake. Imagine that you're slowly, very slowly, gently floating down in the lake, noticing everything around you. And when you are at the bottom of the lake, I want you to maintain your sense of calmness and awareness. I'll give you 5 seconds to do that. Excellent. So I hope a little bit of a taste of guided visual imagery the participants must be experiencing. I hope you can use these experiences to drastically, or these techniques to improve your stress response and manage your life more effectively. If necessary, you can ask me doubts about this or provide the script for this specific exercise as well. So This was guided visual imagery. And finally, I want you to close with to understand the difference between daily stress, subclinical stress, and the clinical significance of a pathology. So a lot of the times people experience this daily stress, and a lot of these techniques are perfectly useful for that. And sometimes people present with your patients, or you yourself might be presenting with subclinical symptoms where it is right below the threshold. And again, a lot of these symptoms, a lot of this technique be useful for that. And when it comes to a clinical level where your pathology is actively interfering with your occupation, obviously you are well educated to understand to seek professional help. So early identification is something that is very key in people, in doctors and in mental health professionals who need to understand how if it is impacting their everyday activities, and to understand the transition from the subclinical aspect where they are trying to manage on their own to a clinical aspect where they should probably seek someone's help. It never hurts to always keep seeking knowledge, keep learning on how to improve yourself, how to manage yourself, seek therapy if it is needed. And finally, have a trusting and accepting environment as well as a safe space where you can explore these aspects of your life. And last, always never fear or never hold yourself back from seeking professional help. So that's about how it could help you in this short duration of time. I hope little exercises worked out and at least some people try to do it. So that's about it. Thank you for listening and thank you for your kind attention.
Thank you, Dr. Shanu, MD, for your wonderful session on stress management for mental health professionals, for the practical demonstration of mindfulness and other stress reduction techniques. If the participants have any